Hello, I'm Dr. Pamela Ruegg. I hold the David J. Ellis Chair at the Department of Large Animal Clinical Sciences at Michigan State University. Today we're going to be talking about scientific papers, specifically the 2011 paper by Pinzon-Sanchez et al. In that paper, we looked at the economics of selective treatment of clinical mastitis. That paper was published in Journal of Dairy Science and is a complex decision tree model. But rest assured, we'll be summarizing it here. Clinical mastitis is the most costly disease in the dairy industry, and preventing it is the most effective way to reduce costs. But sometimes we have to treat them, and our treatment strategy influences how much profit we lose. In our 2011 paper, my former student, Carolina Pinzon-Sanchez, used a decision tree analysis to determine the most economically optimal path for treating non-severe clinical mastitis. In that model, we estimated costs for a first case of clinical mastitis that occurred at 30 days in milk. We used an economic figure called an expected monetary value, but that essentially accounts for all the losses in every conceivable consequence of mastitis, including the cost of drugs, labor, culling, reproductive losses, reduced milk yield, and transmission to other cows, as well as discarded milk. It's a comprehensive summary of the cost of mastitis. Now, what we did in that study was we evaluated 3 different treatment strategies. Strategy 1 was on-farm culture, waiting 24 hours for results before making a treatment decision. Strategy 2 was treat immediately, which means all cases got immediate intramammary antibiotics, but we changed the protocol 24 hours later based on the culture results. And the third strategy was no culture at all. Treat everything using intramammary antibiotics. That paper is long and complex, but the results were consistent, and we'll focus on Table 9. When we look at Table 9, the differences among those strategies was relatively small. For first lactation animals, the cheapest losses were the no treat. For the older cows, it was the treat immediately. But the differences among those outcomes was usually minimal. This tells us that the initial system matters less than the pathogen-specific decisions that are made later. It's telling us that pathogen-specific decisions are really important. That means these culture-based selective treatment strategies make the best economic sense. When we look deeper into the data, you can look at it in Table 9, the best treatment strategy was really obvious. And it was different for different groups of pathogens. For gram-positive cases like environmental strep, the most profitable path was a short 2-day treatment. For a typical herd, that resulted in losses of about $251 for primiparous cows and $367 for older cows. For gram-negative cases like E. coli, the optimal treatment strategy was not to treat with antibiotics. The expected losses were about $267 for those cases, but treating for 8 days would increase those losses to $400. For no growths, those cases where the immune system has already eliminated the pathogen, the best treatment strategy economically is no treatment, and that's especially true in older cows, where the expected economic values are strongly influenced by treatment. Now, perhaps the most practical takeaway from our study is that longer treatment costs a lot more, and that's even after accounting for all of the different outcomes that could occur with mastitis. Using 5 or 8 days of intramammary antibiotics consistently resulted in most losses in every scenario. The model showed that extended durations increased total losses by $33 to $163 per case, as compared to the shorter duration treatments. And that's because the small gains from treatment, 5 to 10% increases in bacteriological cure, simply can't offset the huge losses due to milk discard. So just to summarize this massive 2011 study in just a short time, that study showed a clear picture that the financial impact of mastitis treatment decisions can be influenced by decisions we make about treatment duration. A standard treatment protocol for non-severe clinical mastitis on our farms should be pathogen-specific, and we should target the gram-positive pathogens in general with short-duration treatments. and then no treatment for culture negative and gram negatives. This model we did shows that making good treatment decisions not only benefits the cow, it benefits the profitability of the farm. For more information, you can read the whole study, Pinzon-Sanchez, 2011, in the Journal of Dairy Science.